Why don't we go ahead and get started? So just want to say my name is Nathaniel Van Kirk. I'm the president of OCD Massachusetts and a clinical psychologist working at McLean Hospital. And it's a pleasure to have everyone with us here today. Thank you all so much for joining us this evening for what is our ongoing monthly lecture series as part of OCD Massachusetts. And this month, it's a pleasure to have Kimberley Quinlan with us, who is a licensed marriage and family therapist working in Calabasas, California. So it's still light and sunny and not nearly as cold where you are as it is for those of us on the East Coast. But it's a pleasure to have.
We had 97 degrees yesterday.
Ooh, I think we hit 53 today, so might have to go to California where it's a little bit warmer for a little while.
Right.
Well, so it's for those of you that are joining today, I know Kimberley doesn't really need any introduction, but I'm going to give it anyway. And also you sent me an introduction, so I want to make sure I went over it. But you know, as part of your work, I know we've gotten the chance to present together on a couple of occasions recently, which has been awesome. And so it's a really honor to have you here today to talk with us about the role of self-compassion, as I know that can be a really tricky concept in terms of how to apply, especially when OCD gets involved. And so Kimberley actually has a lot of expertise in treating OCD, anxiety disorders, and eating disorders. In addition, is the founder of the cbtschool.com, which provides a lot of psychoeducational resources for individuals with OCD and body-focused repetitive behaviors. In addition, you also have the Your Anxiety Toolkit podcast that you run as well. And you also recently published a book on the Self-Compassion workbook for OCD. And so it's a real pleasure to have you here to talk about this area of expertise that I think is definitely one that's been gaining a lot of focus within the world of OCD recently, but it's definitely one that's, in many ways, it almost seems harder to implement than it is to talk about. And so looking forward to having you with us to discuss today. And so for those of you that are in attendance to start, Kimberly's going to give us a little bit of an overview. And then what we're going to do from there is we're going to have a little bit of a Q&A and a discussion. And so if you have any questions, please feel free to put them in the Q&A box or in the chat, and I'll pull all those together. And then we'll have a little bit of discussion, answer as many questions as we can. And so with that, I just want to say thank you so much. And Kimberly, I'm going to hand it over to you.
Yeah, thank you. That was a really wonderful introduction. Thank you so much. I'm honored to be here. Really, I am. I'm going to talk with you about some of my favorite topics, which of course involves treating OCD, but mostly using self-compassion to manage treatment. But we're really wanting to look today at grief and loss that particularly come with OCD and OCD diagnosis and OCD treatment. So I'm going to go through here. So the first thing I wanted to just get, really clear is there is so much to grieve when it comes to having OCD, being diagnosed with OCD, getting through OCD, that diagnosis process, and also to treatment. So a few ideas of things that people are grieving, and I hope you can see this, is number one is there's a lot of loss of time, right? A lot of people are grieving the time that has been lost, whether that be to intrusive thoughts or to their compulsions that they've spent many hours doing. Let me see here. Why won't it let me? Hang on. There we go. In addition, there's a loss of identity. A lot of people are grieving the identity that they've lost to OCD. Some people had this idea of how life was going to look for them, and OCD can sort of impact that, impact the way that it played out, impact the way we see each other and see ourselves. It also impacts the loss of experience, right? So many people report, I missed an important event because of how severe my OCD was, or I missed my college graduation or prom, or they missed an important family event, or it could be the little moments, right? Where even though you were there, you weren't totally there mentally because you were distracted with your thoughts. A lot of mothers and parents I speak who say, I feel like those first years of childhood with my baby, I just was so overwhelmed with thoughts. That's one example. So that's often how OCD can present. Another example is the loss of success. Some people have found that their obsessions and compulsions have really gotten in the way of them thriving and reaching their highest level of success, whether that be because studying was hard, or social was difficult, or they struggled with time management because of that. And that has impacted their ability to really thrive the way that they themselves would have thrived had they not had OCD. And then the last one here is there's often a loss of hope. So often one of the biggest things to grieve is that I've lost the hope in my life. And that's a really important piece that I think is important for us to take a look at. So let's see if I can get it. So I want to first look at how grief is experienced, right? There's a few ways we can conceptualize grief, and I'm going to go through them with you really quickly, just so that you can at least have an understanding of what grief may be and what it isn't as well. A lot of people have to, know what grief is, but it's hard to know what grief isn't. So I'm going to use the Elizabeth Kubler-Ross model here, which is explained in the book On Death and Dying. It's a book that you can order on Amazon or get from the library. And she explains that there are these stages of grief. Now, this is true for people who have grief in the terms of like losing a loved one or going through a very large loss in their life. But it's very much, I've seen it play out for people with OCD. In the first stage, there are multiple stages. The first stage that she identifies is denial, which is sort of a stage where we don't want to acknowledge the problem. If there was, let's say, a loss of a loved one, denial is usually experienced as shock, right? Shock that, you still kind of don't really believe that it's happening. Now, that can play out in OCD. It's not totally common for people to have denial. Sometimes when we get the diagnosis of OCD, you may go into a stage of denial where you kind of question your diagnosis and you kind of can't believe that it's taken you this long to get it. But this is a stage that I don't see a lot show up with OCD. It's more the other stages that can get really complicated with OCD. The second one is anger. And this one is very common when you're grieving. When you experience loss, you're naturally going to have a large degree of anger. It doesn't have to happen in these orders. As I give it, it doesn't have to show up in this way. It may show up very mixed. Some find it's exactly this order and some don't. But anger is very, very common, mainly because it makes sense to be angry that your life is not going the way you wanted. It makes total sense to be angry at missing an event or not getting the success that you wanted or the time that was lost, right? That makes total sense. And our job as that anger shows up is to tend to it kindly instead of then judging yourself because of this experience of grief or this thing that you've lost. And we'll talk more about that here in a little bit. The next stage is bargaining. And this is the one I want to just target as much as I can here very quickly. Is bargaining is the stage of grief where we bargain with what could I have done? Did I do something wrong? How could I have prevented this? And so this you can understand if you've lost a loved one, it makes sense that you do this process where you're trying to make sense of this loss. The problem here when it comes to grief, particularly for people who have OCD and the grief process of having OCD, is bargaining looks a lot like mental compulsions. Mental compulsions are the act of trying to solve. And sometimes when someone is grieving, OCD and grieving can collide, and this bargaining stage can become a huge process. What could I have done? How could I have solved this? How could I have prevented this? Whose fault is it? Trying to solve whose fault it is often one, particularly given that one of the things I really worry about, particularly as someone who's on social media a lot for my work, is there are a lot of clinicians out there saying things like, oh, OCD is trauma trapped in your body, or you've got to get it trapped out from your body. And this can be really triggering for people who are stuck in the stage of bargaining, because they're trying to figure like, where is it stuck? What's wrong? What did I do wrong? How could I get it unstuck? And so this is a really important part of grieving to understand and to acknowledge that it's a normal stage of grief. But also ask for help if you're finding that you're getting stuck in this stage by, reaching out to a mental health professional, a doctor, someone who's trained in this particular area. The next stage is depression. It is completely normal when you are having OCD and you've lost so much from OCD to feel either a sense of depression, whether it be in the form of hopelessness, helplessness, worthlessness. This is very common. A loss of hope for the future, as I discussed before, very common to experience this, particularly if OCD has taken a lot from you, taken a lot of your energy, taken a lot of your time, taken a lot of your relationships. That is very common. Again, a normal stage of grief. Again, if you find you're getting stuck in that depression and you're really not finding that it's leaving, that it's staying, it's getting stronger, by all means, reach out to a professional and they may be able to help you work through your grief about having OCD and how it's impacted your life. And then the last stage is acceptance. Now, I'm going to talk a lot about acceptance later on as I present here, but acceptance is coming to a place not where you like the fact that you had OCD and you wish more OCD. That's not what acceptance is. When it comes to grief, acceptance is acknowledging that it happened, no longer beating yourself up for it, no longer trying to resolve why it happened, you may still experience some of these emotions, right? You don't have to land on acceptance and stay there, but be gentle and accepting of the anger and sadness that shows up as you grieve, because you will continue to grieve. It's not a one and done. It's something that sort of a lot of patients I've had will often say, I'll be fine, and then I'm not. And then I get hit with a wave of grief, and it's so overwhelming and it cycles really quickly. It feels so confusing. What happened? I was fine and now I'm struggling. And acceptance can be a part of acknowledging that this too will come and go with time, over time, particularly again, if you've lost a lot to having OCD. Now, since those 5 stages, David Kessler, who wrote a book called Finding Meaning, also added that there is a 6th stage, which is about finding meaning and placing purpose on your OCD, whether that be I am going to find meaning in the way of getting recovery and spending as much time, getting back as much time as I can with my family and friends and my career, or whatever, your religion, whatever fills you up. Right? Finding meaning for others is advocating, helping other people, sharing it forward. And so that is another way in which we can go through the stages of grief. A lot of people in the OCD community are doing a beautiful job of this, which is trying to find a way that they can turn their pain into purpose. Again, you don't have to do this. In fact, in my recent book, the Self-Compassion Workbook for OCD, at the end, I discuss this at length in one of the chapters, and I share a story about how a client of mine didn't want to advocate. That wasn't really in line with them, but they felt that even if they wrote a letter to one person and gave that letter to one person with OCD, that made it worthwhile for them. And so this can show up in whatever way feels right to you. This is, again, finding meaning in your own suffering. Now, one other option here to consider in understanding grief is understanding that anxiety and guilt are also a part of the grief process. When you've been through something really traumatic like OCD, very distressing like OCD, it's natural that your brain is going to be really aware of when this could happen again. And often people experience a large degree of anxiety with their grief, or a large degree of guilt, right? Guilt is a big one. Again, I talk at length about it in my book around feeling guilty for impacting other people, feeling guilty that, that you may have harmed somebody or may have hurt somebody. And these are very common, as we know it with people with OCD. They tend to be very hard on themselves and tend to feel a lot of guilt and sometimes shame as well. Now, let me get through this really quick. So how grief and OCD sufferers can collide is people with OCD already, from my experience, usually are very self-judgmental. They're very critical of the thoughts they have, the feelings they have, the sensations they experience, the urges they experience. And so what often happens is when you're going through grief, that can be really overwhelming, particularly if you're someone who is really judgmental of themselves. You'd never judge other people this way, but you tend to be really hard and your expectations on yourself are very high. Another thing that happens, particularly with OCD, is high levels of self-criticism. And again, this can be an additional struggle for people with grief, because not only are you feeling a deep sense of loss of what's been taken from you, but then you beat yourself up because of what's been taken of you, right, and from you. And the last one, which I really want to emphasize, is a lot of people with OCD engage in self-punishment compulsions. And I call it a compulsion because so often I hear people with OCD, well, because they've had an intrusive thought that's painful, they then will engage in either withdrawing from pleasure or punishing themselves, some examples might be only give themselves a cold shower. They won't give themselves pleasurable food items during the day. They make themselves push harder during their workouts. They withhold sleep and pleasure. They an example would be, I've had patients who will say, like, I'll only buy the cheap version of self-care products because I don't deserve the nice, luxurious ones, right? And so this can really impact the grief process because you're already grieving. You're already gone through something that was never your fault, but then you engage in behaviors that kind of reinforce this belief or thought process that it was your fault and you deserve to be punished. So I wanted to just emphasize that because it's a part of having OCD that we don't talk about enough. And we then have to grieve the fact that we may have engaged in these behaviors, right? It doesn't feel good when you look back and go, wow, I've been really hard on myself. I've often had patients be devastated by that acknowledgement of like, wow, I have really treated myself poorly for many years. And that is a painful thing to have to really take on. All right. And the last one is shame. We do experience a lot of shame around the thoughts we have, the feelings we have, and so forth. So here we land at compassion. And this is where I want to sort of give you a quick run by on how self-compassion can help. So self-compassion is simply giving yourself the same level of support and care that you would give a loved one if they had a similar problem, and then doing that same action for yourself, right? So you can imagine if your friend or your family member came and said, I am deeply grieving. I'm so sad. I'm managing a mental illness called OCD. I have intrusive thoughts. I get stuck doing compulsions that are so painful for me. You would think about, what would you say to them? How would you act towards them? How would you tend to them? Would you put your hand on their shoulder? Would you lean in? Would you soften your voice? Would you soften your eyes? And so self-compassion is doing exactly that for yourself. So it's nurturing emotions and your own experience of suffering. Grief, so often when we feel grief, it's an uncomfortable feeling, just like OCD is. They're obsessions, right? It's an uncomfortable feeling. And naturally, when people are grieving, we want to step out of that and go into what we do have control over, what we can grasp at, what we can control. But self-compassion is staying out of those avoidant or attachment-like behaviors, and instead meeting your loss and grief with tenderness, right? Self-compassion is speaking to yourself just like you would a loved one, using those kind, encouraging words instead of demeaning and unkind words, sometimes even judgmental criticisms. It's speaking to yourself from your wise, and I'll talk more in a minute about being wise, your wise, warm, compassionate self, and also providing an environment where you thrive, right? Sometimes compassion isn't just nurturing and warmth and kindness, and I'll talk about that in just a second. All right. So what does self-compassion look like? Here is where you can apply these skills with simply your OCD if you don't experience grief. You can apply these skills as you do exposures. We call it self-compassionate, ERP. Or you can apply these skills when you're really experiencing a lot of grief and loss. So one example would be acceptance of what is. So often when we have an event that we've missed and we've lost, our instinct is to try to negotiate, like we talked about in the bargaining stage, to negotiate how we can solve this so that it never happens again. Now, that in and of itself is a self-protective measure. It's a kind act because really all you're trying to do is protect you from the future, right? Protect you from harm in the future. But acceptance is the opposite of that, which is saying, I am going to accept that it did happen, right? And a part of the OCD treatment is acknowledging the uncertainty around that, because OCD is going to come in really quick and be like, we need to find certainty. Like, what could you have done? How could we fix this? And acceptance is just being in that feeling and not trying to make it any different, just acknowledging that it is what it is. The next thing is it's balancing nurturing compassion with active self-compassion. And there is a difference. So there's a lot, my main concern, and I'll tell you my own anxiety, is as I was writing the book, my biggest fear was that people would think self-compassion is a tool that is used just to take away your discomfort. And that is not self-compassion at all. Self-compassion is, instead of taking discomfort away, it's meeting it and nurturing your suffering, right? Now, in addition, a lot of people have asked me these questions. As I was writing the book, I was getting this question a lot, which is, but isn't sort of self-compassion letting yourself off the hook all the time? Like, oh, it's okay. You don't have to do your homework. And it's okay. The compassionate thing is to stay home and avoid that thing because that's really uncomfortable. A lot to do with grief and a lot to do with OCD recovery is not that. It can be that, but sometimes it's going to be you being really active in your self-compassion and being really fierce in doing what's best for you in the long term, not giving yourself short-term relief, but doing the thing that's the hard thing that gets you the long-term recovery or the long-term management of your grief. Sometimes it's choosing the hard thing. Sometimes it's choosing the uncomfortable thing. Sometimes it's choosing the thing that requires a lot of energy, right? Like feeling your emotions can be a very painful experience, but it's better than running away from your emotions, right? And then creating other problems along the way. You may ask any questions about this in the Q&A because it's probably the most common questions I get. The next is making space for two opposing emotions and truths at the same time. So often clients will say, if I accept my grief, does that mean I like my grief or I want to have grief? No. So you can accept grief, but also be moving through grief at the same time. Just like this is a really common one with OCD treatment, is you can have fear and go and live your happy life at the same time. Those two opposing truths can happen at the same time. You can be anxious and act according to your values at the very same time. You can grieve what is lost while also moving forward with your recovery, with your life at the very same time. And compassion is making space for both of those things, multiple things at the same time, instead of thinking of them in this very black and white way. Okay. How are we doing here? Okay, that was quick. Sorry. So in addition, self-compassion is staying with the grief, right? Often when we feel grief, we don't want to feel it. It's so painful, right? And you've already been through enough pain and you've already got exposures to do. And it's so easy to want to step out of it, but the goal is to stay with it compassionately, right? Doesn't mean you need to sit on the couch and not do anything that you enjoy. You can grieve while you are doing your daily activities. There will be times where you need to stop, and that may be this compassionate act, but there will be other times where you'll need to show up and bring grief with you. Self-compassion is the absence of self-criticism and self-punishment. So sometimes the best exposure, particularly for those who have grieved, is to treat yourself with nothing but kindness and warmth and pleasure and rewards and joy and the things that bring you a sense of worthiness and value, right? Those two truths can happen at the same time. You can grieve and still act according to those values. And then the next thing is being open and willing to be experiencing more than one emotion at the same time. So while you feel grief, you may also feel a different emotion like hope. While you feel grief, you might feel an emotion of acceptance. Like while you feel sad about what's lost, you might feel a teeny tiny moment where you feel empowered through this process, that we can actually make space for more than one emotion at the same time. All right. And here we go. Last slide. I just wanted to run through this really quickly. So most people, and this may be in the Q&A, I can't see the Q&As right now, but most people, when I talk to them about self-compassion, they have lots of buts. And what I mean by buts is they have lots of reasons to believe that they are disqualified for receiving self-compassion. And so what I wanted to do was quickly run through the most common that I see with OCD. So I'll go through these as quick as I can because I want to make sure lots of time for questions. Number one, I do not deserve self-compassion because of the content of my obsessions. That is untrue. Your thoughts do not define your worth or your deservingness of self-compassion. The next one is, I am not worthy of self-compassion because I have a mental illness. That is also not true. A mental illness does not disqualify you from being equal of every other human right and respect that every other human has. Again, I know there is a lot of stigma, but I would even argue that those who have OCD deserve more self-compassion than anybody else, given how hard it is to get better with OCD and to manage OCD. The next one is, I am too preoccupied with anxiety, panic, and uncertainty to practice self-compassion, right? A lot of people say, I would practice it, but I'm so overwhelmed with grief and anxiety and uncertainty. That's a common one. And we can find ways to implement these practices, and that actually helps recovery. The next one is, it feels wrong to practice self-compassion. Now, while it may feel wrong, we go back to your last slide and say, you can make space for that emotion. While it feels wrong, you can also practice it, that those two opposing things can still happen at the same time. They don't disqualify each other, right? We don't want to wait until it feels right, because that's probably not going to happen, right? Self-compassion, most people say it just feels weird to start with. So sometimes you have to kind of fake it till you make it. The next one is self-criticism and self-punishment are how I motivate myself. Research has shown that people who use self-criticism and self-punishment for motivation tend to, number one, succeed less. They tend to procrastinate more, and they tend to burn out in their motivation. It's not a very well-sustained practice. And so what we know is practicing supporting yourself from a place of self-compassion has better outcomes. You procrastinate less. You tend to sustain the motivation for longer, and tends to raise a person's sense of self-agency, that they can tolerate uncomfortable things because they know even when things get hard, I'll be there being kind for myself, right? Such a beautiful practice. The next one is, well, what if self-compassion makes me weak and lazy? Very common one. Again, as I said, people who practice self-compassion tend to be more motivated, more inspired, more energized, less procrastination. And a big one is, what if practicing self-compassion makes me snap and lose control? Very, very common one, particularly for those who have harm obsessions, sexual obsessions, sexual orientation obsessions, and religious obsessions. Again, we actually can use self-compassion as an opportunity, as a practice and exposure. Sometimes it's an exposure to practice compassion, and that's very, very beneficial. The last one is practicing self-compassion could make me self-centered. Here is my answer to that. If practicing self-compassion makes you self-centered, it's probably that you weren't practicing self-compassion because self-compassion is nothing except tending to your discomfort, leaning in towards your discomfort kindly instead of berating and being very critical. So the main thing to remember with that is most of the time when we're compassionate, we usually have more space to help other people and to be open to other people's struggles as well. I know that's the case for me as a clinician. And so that sort of breaks through that myth about self-compassion. So that's it for now. I'm happy to answer your questions. I can see there are already a few coming in. Nathaniel, how are we doing on time? I've not got a clock.
No, we're doing great on time. So we have about 25 minutes for discussion. So I think that was perfect. And thank you so much for a wonderful overview. And I think it's two really important topics. The first, with the self-compassion piece, and the other with kind of grief.
Yeah.
And I know kind of both of these kind of topics alone could be hours of discussion.
Yes.
Together even more so. And so why don't we go over a few? We have some great questions in the Q&A and the chat. And so I've kind of been putting some of these together that I figure we can go through and discuss a little bit.
By all means, yes.
There we go. All right. So one question that came in at the beginning, I think is a really good one, is, and dovetails with a lot of what you were saying in terms of that sense of loss and grief and the different ways that may manifest. And so the question is around, is any advice on how to find distance from ruminations that are kind of based on the loss of sense of self and that feeling of loss due to OCD and chronic illness that they're talking about, that sometimes the rumination kind of catches hold of that and they get stuck in that ruminative loop in a sense.
Yeah.
And kind of use that avoidant behavior to try to cope with it in a compulsion sense. And so they were asking, how do I accept my pain while managing my OCD in these instances? And how can I break away from that rumination loop in the presence of kind of real physical pain that's there in addition?
Yeah, it's a really good question. So I've actually found self-compassion to be a really helpful tool when we're mentally ruminating. Often, and this is actually why one of the main reasons I wrote the book is I would often get questions from people saying, when I'm ruminating or doing a mental compulsion, if I'm not doing that, what am I supposed to do? And a lot of clinicians had said, like, you just go and live your life. And so think of self-compassion again as little moments. And the one thing I really want to say here before I move forward is I really don't want anyone here to think self-compassion is this bright and shiny unicorns and rainbows. It's not. It's in the trenches with your pain, not running away from it. And it's not making it better, right? Self-compassion is not making it into roses and unicorns. It's just minute by minute making space for it. So I really don't want to oversell it as something that's going to be like, make a painful event turn into a pleasant event. And so I think the main thing is it's just being there gently with the absence of going down the narrative of how bad it's going to be in the future. So often with grief, again, with that bargaining stage, is you can fall into that depressive stage by going, there's no hope for me. Life is going to be really hard for me. But we actually don't know that, right? So the self-compassionate act is to say, what would the me in a year, what do I need to do right now to be the me I want to be in a year? And write it down. I have a lot of my patients write it down. What in a year's time, if I was showing up, what would I do differently? How would I show up around my pain? It's not like in a year we're going to have no pain, but how can I show up differently? Does that answer that question?
I think so. And I really like kind of the idea that what you're talking about of, I think self-compassion at times does get this kind of like you said, like sunshine, rainbows, unicorns. It's kind of like what cognitive restructuring used to, like people would think of that as like, oh, if I change this, then everything's going to be better.
Yeah.
And so we talk a lot about like, well, no, it's just seeing what is there, the good and the bad. And I feel like you're describing self-compassion in a similar way.
Yeah.
I think is really, really helpful. And that's not about avoiding pain or getting rid of it, but leaning into it, but not adding to it with that kind of ruminative component of self-criticism.
Right. And
I also love
minute to minute, right?
Yeah.
It's just minute to minute. And you can, I will often with my patients, I'm not going to say, go sit in that for an hour. I'll say, can you just do it for a minute? Just for 1 minute. Because with that, you will strengthen that muscle and it'll be 1 minute of discomfort because you have discomfort anyway. It'll be 1 minute where you did it gently instead of judgmentally or critically.
And I think it actually really, how you just described that dovetails really nicely with actually what Jason Crompton was saying in last month's webinar on rumination, that I think goes to this question that sometimes rumination is a way to, or can be almost like a form of like the devil, where if you're so used to it and kind of push that away a little bit or not have to necessarily accept like, yes, when I have X, Y, or Z in the future, because I'm focused on the past, but self-compassion might be that method to allow yourself to try to lean into it in the future and not use that rumination as like kind of the devil. And so I think those two actually dovetail really nicely.
Yeah.
And I think it actually sets up the next question really well, because you mentioned the swing into the depression kind of component, especially following like grief and loss. Mm-hmm. And so one question that came up is, when I'm depressed, it's really hard to experience joy and pleasure anyway. And so how can one be more self-compassionate when you have a hard time even feeling anything positive at all?
So I love this question because it pulls exactly into the predicament people have with self-compassion is, again, when we're depressed, I know for me, when I'm depressed, when I'm in a depressed state, trying to be joyful and have pleasure, those two are so far away from each other that focusing on having joy and pleasure can actually make me feel more depressed. For me, self-compassion when I'm depressed is just acknowledging, yes, Kimberly, this is hard. This is not easy. Anybody in this situation would feel exactly the way I feel, right? That's compassion. It's not trying to get away from the feeling. It's actually being a warm, safe place to be while you're depressed, right? And so I really discourage my patients and myself, anytime where I'm in that state, to not be looking up at the stars, wishing you were up here, or going onto social media, seeing how joyful everyone is, but instead just to acknowledge, yes, this is really hard on you. What can I do for you right now that would support you while you feel this way, right? And what I found is it does tend to soften the depression, right? And the grief. It doesn't make it go away. It softens it, and it doesn't make it such a prickly place to be. And I can move out of that place in a less sort of abusive way, because we can be very critical. It just allows us to get up and brush our teeth if that's what we need to do. So I wouldn't focus on the positive. I would just meet yourself with validation and kindness. And then you can, if you're able, you may say, what would the 8 o'clock, the evening Kimberley wish I'd done right now? Well, like if it's in the morning, well, the evening Kimberley would have loved if you just gone and brush your teeth, or you took a walk out in nature. Okay, let's try to get there and have that be the goal.
Also a way to kind of help you reconnect with what's important, or that value kind of driven piece, where we kind of lose it sometimes, especially when we're self-critical.
Yeah.
We're busy beating ourselves up.
Yeah. And we think of joy and pleasure, and we think of I just think of skipping and happy. And when we're in grief, that is such a reach. So the most compassionate thing we can do is drop that expectation and just take one teeny step in that direction. Just teeny.
I like that. Yeah. I like that idea of kind of dropping the expectation too. And it kind of goes with, so one of the questions actually came from that was also, they mentioned similar to how too much empathy at times can be problematic or unhealthy in some contexts. And I know this is something that within the OCD world too, we talk a little bit about, where an OCD kind of latches onto that and makes it hard to kind of hold it in balance. Mm-hmm. They're asking, does self-compassion have its own limit to utility? I think this goes with what you're saying, like those little moments versus like this big kind of like shiny thing. Yeah. But could you maybe talk a little bit more to that?
Mm-hmm. So again, this is one tool in a tool belt, right? So it's something, of course, I should have even highlighted this, is we are still looking at ERP as the king of our goal here, right? Of staring fear in the face and so forth. Think of self-compassion as a safe place to do that, right? So the way I share about it in my book is ERP is the bread and the cheese of the sandwich. It's where all the nourishment is. It's where all the good stuff is. We can do, and that's staring fear in the face, right? Like that's hard work. No one wants to do it, but if you can do it, it's amazing. We can do ERP really aggressively and with a really critical voice and not celebrate our wins, or we can do it kindly and like a cheerleader, and that in and of itself, think of it just like just like a superpower. In my opinion, self-compassion is a superpower. Its limitations are when we use it only in that nurturing way, right? Newer research in self-compassion is now seeing that a lot of people thought they were practicing self-compassion when they weren't practicing it at all. They were saying it's okay to not do the hard thing. And it is okay sometimes to not do the hard thing. But self-compassion, particularly the way I like to use it with OCD treatment, is using self-compassion to get you to do the hard thing, because that's what the future you needs, right?
Excellent.
Go ahead.
Go ahead.
No, all I was going to say is the most compassionate thing sometimes we can do is the hard thing.
Yeah. And I really like that kind of idea in terms of like when we think about self-compassion versus letting yourself off the hook, which I really appreciate you kind of highlighting during your talks. I think that's a really common experience. Mm-hmm. I mean, I think all of us struggle with that at times, myself included.
Yeah.
And I see some comments about that too, about that idea of like kind of giving yourself like the rest or the days off sometimes can kick off that OCD and rumination cycle of then trying to like compare, or how am I doing compared to my peers? And what do we do with that when we're grieving like the time lost And kind of what I'm hearing you say in the self-compassion component is that it's not so much about just the, like you said, the nurturing piece of giving yourself that time off or taking care of yourself by like avoiding, but more of taking care of like you and your future by doing the hard stuff, but not necessarily judging yourself for it not going perfectly.
Yeah. And the thing to remember is we have to be self-compassionate about our self-compassion actions, right? Because it's mostly trial. That's why I highlighted the word wise before. What I've found for myself and for my patients is you have to find a balance between the nurturing part of compassion and that active part of compassion. If you're doing only nurturing, that's fine. But that's where the limitation is, right? Because if you're just going, it's, oh, this is really hard, I'm going to just take care of myself and take a week off work or whatever. Sometimes that is compassion, right? Like, I have a medical illness, and I often have to be in my wise mind of going, how exhausted are you? Do you actually need time to rest? Do you actually need time to refuel? But then I still have to be asking myself, how does it benefit me to take a week off? Will that actually create more stress for me in the future? Will me doing this exposure benefit me more than it will if I took the time off from that? And really connecting with trialing and error, this balance between active and nurturing compassion.
And I think that really goes to one of the other questions from a parent in the audience is talking about, like, how do I balance practicing self-compassion with all the realistic support and feedback for loved ones? And in a way, I feel like you kind of answered that with that it's not necessarily, you're kind of doing it in a non-judgmental stance, but also being kind of clear and objective with the feedback, but also allowing it to kind of have that, non-judgmental approach. I'm noticing this, and I know it's at times like you may need to take a little bit of time off, but what do you also need to do to move forward in life? Yeah. Kind of balancing those.
Exactly. I think the thing to remember here is some self-compassion doesn't tie it in a pretty bow. Particularly, I'm a parent, and I get it. There are days when I have to just accept that I didn't meet everybody's needs today, right? Just like someone with OCD, there are days where they have to really come to grips with the grief of, like, I didn't do as well in my ERP as I would have wished, right? Or I did way more compulsions than I had planned to do, And so at the end of the day, we can easily fall into, like, here are the 12 ways I didn't do well. And compassion is a wonderful place to just meet that and go, yeah, that's what humans do. They don't meet everybody's needs. That's what we unfortunately can't. And compassion is also accepting our imperfection in our self-compassion practice and in our daily lives. So yeah, as a parent, self-compassion has saved me hundreds of hours of self-criticism at the evenings when you look and you're like, oh, I didn't do great with that one. I didn't handle that well.
But so I think we have a few final questions. I know we're kind of coming up in the last few minutes. And so one that came up, I kind of wanted to shift back a little bit to that grief piece that you were talking about. In terms of, like, the idea of both self-criticism, one of the questions that came in is, self-criticism for a long time was helpful in motivating me to get to certain places. But at the same time, feeling that kind of grief over the loss of success that comes with it. And I think one of the things that you and I have talked about in some of our previous ones is that sometimes ERP is kind of isn't like the end all be all goal as much as the stepping stone to life. And that sometimes some of the harder work actually starts right after, in terms of figuring out what is next. And so one of the questions was, how can I kind of undo the way that I've thought my entire life of using self-criticism to be that, which was helpful in being successful in certain areas, but now has become a limit.
Yeah.
How can I undo that?
Mm-hmm. So how would you undo it is you would slowly and gently replace the voice I call them coaches, right? So I speak about this in the book. Like, imagine the typical American basketball or football coaches, like, get down and give me 20 and you better do great. You're a loser. And it's like, that.
Yeah.
That does get you to run very fast and do very well and scares you into change. So it does work. But what else works is what I call a kind coach. He or she does the same thing, but instead of using threats and criticisms to motivate you, number one, they know what your strengths are and they highlight your strengths. Number two, they know what your weaknesses are and they support you through the weaknesses using a language that is encouraging, right? And they celebrate your wins. So if you win, they don't say, I expected you to win. They say, look what you did. You just did something really hard. Even though it's easy for other people, can you see, let's just stop for a second and see what you just did. And the kind coach can do exactly the same work as the critical coach without you leaving feeling like you've been beaten into a pulp. And so I would encourage you to, I talk a lot about this because self-motivation is a huge piece of OCD recovery. Therapists aren't there to clap you along. They're usually only there once a week, maybe a couple of hours a week. So a lot of it is you self-coaching, and you would replace the critical voice with this kind but reinforcing coach voice. And that can sometimes change lives.
Yeah, I definitely agree with that. I think I like the idea also of using it flexibly, right? Is that just because one thing, like we talk about with rituals, most rituals start out as behaviors that in some way were functional, but usually for something very different, but just became so extreme. I think that self-critical piece at times, there are times where it was helpful, but can we use it flexibly and not use it as our only tool?
Yes.
And so the last two that come up, one was about having intrusive thoughts regarding serious trauma and having the thoughts run like a broken kind of film reel. And I'll kind of add a little bit. I know we've talked about this actually at the last IOCDF conference, which was the idea that with trauma at times, there is a time where trauma treatment may be warranted to help someone work through traumas and be able to kind of re-engage in ERP at that time. So I think with the intrusive thoughts, one thing, and this is probably actually a talk that we're going to have a little bit later in the year, but separating out to what are intrusive thoughts OCD-wise and what are intrusive recollections and memories that are trauma-based, and making sure you're using the appropriate treatment for both. But I do think self-compassion plays a role in both, especially those traumas involve loss, grief, but also the idea of that hindsight bias of at a certain point, even when it comes to traumas, we tend to kind of use all the information we have now to say, well, I should have done this, or if only I had done this. But forget we didn't have that information at the time. Could you maybe say just a few more statements on that in terms of how you see self-compassion might play into that situation?
Yeah, and that goes back to sort of the grief. The bargaining stage shows up in many situations, right? A lot of, if you've been through a trauma or an actual traumatic event, you're naturally going to bargain for many hours. It's a normal part of it. But if you're stuck there, definitely do reach out to a clinician. How self-compassion can play is, again, it's that wise acknowledgement of underneath your bargaining is a deep sense of sadness and grief for what you've been through, a deep sense of loss that this was never supposed to happen to you. And you're struggling with that, and rightfully so. So self-compassion can acknowledge and validate that and ask, what do you need? We can't take it away. We can't fix what happened. What would the future you be doing right now to help you move through this in a way that is kind and compassionate instead of critical and judgmental? And sometimes just the question of what do you need can be the most self-compassionate response that you can give. It's a powerful question when you can be really honest with yourself and meet the real emotion underneath, which is obviously just sadness and loss. Life is really, really hard, and these are really painful things to have to go through.
And it reminds me of a quote from one of the books I was reading, that they were talking about like going through a large chunk of life wishing that that things would be better if I just didn't have to deal with X, Y, or Z. And then at some point in life, realizing that X, Y, and Z was actually what made life worthwhile. Right. That those bumps are always there. They're part of the process.
Yeah.
And part of what makes meaning out of it.
Yeah.
And it seems like self-compassion can be a very important role in that.
Yeah.
The final question is asking, where do you get all your wisdom? And do you have any suggestions for other places that people can look to learn more about self-compassion, and kind of like the ACT-based philosophies of acceptance, people to listen to, in addition to your podcast and your new workbook? So highly recommend those. Do you have other recommendations of places where people can find out more?
Yeah. So just to clarify, were they saying, where do I get my wisdom, or where can they get their wisdom?
They were asking where you got your wisdom, and where they can also gain some of that wisdom and get some for themselves.
Sure. Yeah. So I think I got a lot of therapy, and thankfully I get to be around people who have OCD and work through painful stuff every day. That in and of itself has taught me everything I know. Right. So 100% I owe most of my wisdom to my clients. But in addition, resources. So yes, I talk a lot about self-compassion in my podcast. Resources I love are anything by Kristen Neff. She's actually one of the biggest researchers. A lot of the concepts from my book came from her and Christopher Germer. So you can go to mindfulselfcompassion.org. In addition, Paul Gilbert in the UK created compassion-focused therapy, which he also has a lot of books, including Dennis Turch has a lot of books about self-compassion. And then my favorite, she's actually been on my podcast, but is Tara Brach. She is a meditation teacher, but she's very easy to listen to, very sweet, lots of funny jokes. And you can get her podcast at tarabrach.com. And I think that's the main stuff for right now.
Excellent. Well, thank you so much for coming to talk with us and share your expertise and wisdom in this domain. I really appreciate it. It's always wonderful to chat with you and get to hear. Every time I hear you speak, I learn a little bit more of how to utilize self-compassion. And I really appreciate all the time and effort that you put into it and sharing it with the community. So thank you so much for joining us.
My pleasure.